At Aurora Medical Services, from very early in your pregnancy until you're 9 weeks pregnant, we offer medication abortion. With a medical abortion, you take pills that cause a miscarriage and allows you to have your abortion at home. We use 2 medications, one of which you take in the office with us, called mifepristone or mifeprex, and the other you take at home vaginally several hours to several days later, called misoprostol or cytotec. When you call our office to make an appointment, we'll ask you many questions over the phone that will allow us to make the appropriate appointment for you. One of the most important questions we will ask is when your last menstrual period was, or when you think you got pregnant, so that we can determine whether you are actually eligible for a medication abortion or not. When you arrive at our office, you'll be handed some paperwork. The paperwork includes forms to fill out, such as your past medical history and a consent form, as well as some information for you about the medical abortion process. After you're done with your paperwork, you'll come back to our patient education room and have a one-on-one meeting with one of our staff members. At the beginning of this process, we insist that you be in the patient education room alone, one-on-one with our staff member. It's important to us to determine that the choice to have an abortion is yours. Once that's established, if you would like your partner, a family member, or a friend in with you, that's fine from that point on. The rest of your time in the patient education room will be to go over your past medical history, to describe the medical abortion process with you in detail, and make sure you understand what is going to happen, and to answer any questions you may have about the abortion process or about the birth control you should choose once the abortion process is over. After that, you'll be taken back to the exam room. In the exam room, you'll have your blood pressure and pulse taken. You'll have your finger poked to give us your blood count and blood type. And then you'll meet the doctor. When I walk into the room to do a medical abortion, I'll introduce myself, and then we'll quickly do a pelvic exam and ultrasound to determine are you in fact eligible for a medical abortion today. If the answer is yes, I'll leave the room to let you get dressed. When I come back into the room, we'll go over your medical history in detail. We'll go through the abortion process in detail as well. I'm going to give you the mifepristone in the office, and you're going to take that pill by mouth. Then we're going to go through your pain medications, and generally we send you home with a high dose of ibuprofen and a low dose narcotic. Most people are quite comfortable with those. In addition, I'm going to give you 4 misoprostol tablets. You're going to insert those in your vagina at home anytime from 6 hours after you leave the office to 72 hours after you leave the office. That way you can choose to have your abortion in a time frame that makes sense for you. When you feel it's time for you to do your misoprostol, I suggest you take one of each of your pain medicines and then lie down and insert your 4 misoprostol tablets into your vagina. You can expect to start cramping in about 2 to 4 hours after you take your misoprostol, and bleeding usually follows shortly thereafter. For most women, the process is over in 4 to 6 hours, but for some women it can take many more hours than that, and on rare occasion up to several days. Women describe the process as anywhere from very mild cramping to very heavy, uncomfortable cramping that can last for a very long time. Bleeding can be very heavy with large clots as well. When you have a medical abortion, we insist that you come back for a follow-up exam. The purpose of this exam is to make sure that the pregnancy has ended. Medical abortion is 96 to 98% effective. On rare occasion, people need to take another dose of misoprostol, and on an even rarer occasion, need to have a surgical abortion to complete the process. It's important to us that you feel comfortable with what to expect before you leave our office, and it's also important to us that you feel comfortable to call us with questions or concerns after you leave our office. As always, we're available by phone.